How can psychological factors influence obesity and how that can be addressed? That can be a very complex situation or question because psychological factors can include anxiety, depression, bipolar, other kind of mood disorders that people can eat as a result of that. So for instance, patients who have depression may either gain weight because they're eating more because of depression, or they may lose weight because they're eating less because of depression. Sometimes people have binge eating disorder, which is another psychological or mental health condition. A lot of times though, in general, we eat for emotional reasons. So even if there's no psychological chronic condition, we might eat because we're lonely. We might eat food because we're bored. We might eat food because we're sad. Our nephew didn't make the football team and he's the best quarterback they had. And so, boo hoo hoo, we're kind of eating the potato chips, which isn't going to put him on the team. They like change our waist, but we tend to eat for comfort. And, I talk to patients that it's like we're looking for something to soothe those negative emotions of boredom or loneliness or sadness or depression. And, I talk about when you're a kid, if you hurt yourself, you fall, you scrape your knee, what do your parents do? They typically give you a sucker or a cookie or something to put in our mouth. You have the 2-year-old, they're screaming at the storm. What do? You put a binky in their mouth to get them to be quiet. So the idea is we put things in our mouth for comfort. And it's almost like we're looking to nurse for comfort, but obviously we can't do that as grown-ups, but we still have that oral part of we're having these negative emotions. We want to put something in our mouth to have more comfort. And so a lot of times people reach for food and then they put the food in their mouth. So again, when you talk about mental conditions, anxiety, depression, or just run-of-the-mill day-to-day stressors, and we're looking for comfort, we tend to reach for food to help us feel better.